I'm going to open with some remarks. Thanks, first of all, for the leadership of this committee for holding this hearing. It's a topic that's top on the minds of Iowans, high health care costs. It's kind of suffocating Americans for decades. One example occurs at the pharmacy counter. I've heard from countless Iowans that high prescription drug prices frequently lead folks to having to choose between paying for their prescription and other necessities. That's why for years I've worked to bring transparency and accountability to tactics deployed by the pharmacy benefit managers, or PBMs, and I'm not the only one in Congress doing it. In fact, the leadership of this committee is working on that as well. PBMs play a significant role in the pharmaceutical drug supply chain. They act as middlemen, processing prescriptions, negotiating prices, setting formularies. My bipartisan legislation would increase transparencies to better hold PBMs accountable. While not wholly within the committee's jurisdiction for my legislation, I hope my colleagues will see the importance of acting on PBM reform as soon as possible. High prescription drug prices are one of the several factors driving up health care costs. The rising cost of health care is also evident from escalating health insurance premiums and required copays. There are many parallels between the conversations we're having today and the ones that I had with my Senate colleagues back in 2009. Unfortunately, my colleagues on the other side of the aisle were raced through Obamacare on a partisan basis. At the time, my Democrat colleagues claimed the law would bend the cost curve down. It's now evident that that was false, as was the promise that individuals could keep their health plan if they liked it. Since the enactment of Obamacare, millions of Americans have been thrown off their preferred health plan, while health insurance premiums have skyrocketed. According to Paragon Institute, since 2014, Obamacare benchmark premiums have increased 129%. For a 50-year-old enrollee, Obamacare premiums have increased twice as fast as premiums for employer-provided coverage and 3 times faster than inflation. That leaves us here today revisiting the debate on ways to bend the health care costs curve. We need to find a solution that will allow all Americans to breathe a little easier when they seek health care, while also ensuring those with pre-existing conditions are protected. So, Mr. Holz-Eakin, I've been a proponent of shining light on health care costs, providing businesses the opportunity to help their employees get health insurance, and allowing consumers the ability to shop for options. You recently expressed concern that some of the new mandates around drug pricing, surprise billing, and transparency can add burdens which may erode, I want to quote, the comparative advantage of the private market, unquote. I'd like to have you elaborate on the factors Congress should consider as they seek to promote greater health care transparency and competitive private insurance market.
I'm not exactly sure where that quote's from, but the general concern is mandates as opposed to transparency, restricting the ability of the private sector to effectively respond to incentives to control costs. That's been my concern with the ACA from the outset. It was a heavily one-size-fits-all, rigid mandate-driven system. Making it more transparent as to how it works, I don't think changes that. And so I think, as I said in my written testimony, a way to get better health policies is to remember that the delivery of insurance, devices, drugs, medical services is an economic activity, and we should have the same standards for good economic policy and health as we have elsewhere, and that includes keeping taxes low and broad-based, and keeping regulations efficient and targeted on real problems. And that's, I'm just worried about an excessively regulatory approach.
I'll have to submit the rest of my questions.
Thank you, Senator Grassley.